Hi everyone, this is Dr. Viet Lee from the Academy of Online Radiology Education. I work at Cincinnati Children's Hospital Medical Center in Ohio. I would like to thank our senior editors for their contributions to this month's Pediatric Radiology blog, Dr. Paul Gillerman from Texas Children's Hospital in Houston, Texas, and Dr. Alex Tobin from Cincinnati Children's. We are very excited to share the current literature in pediatric radiology with you. Extracardiac imaging findings in COVID-19 associated multisystem inflammatory syndrome in children. This is a retrospective study from April to July of 2020 that describes the extracardiac radiologic findings of MISC. The most common chest radiograph findings were pulmonary opacities, peribronchial thickening, and normal chest x-rays. The most common extrapulmonary findings were small volume ascites, right lower quadrant bowel wall thickening, gallbladder wall thickening, and cervical and abdominal lymphadenopathy. Ultrasound for the diagnosis of malrotation and volvulus in children and adolescents, a systematic review and meta-analysis. This systematic review and meta-analysis determined the diagnostic accuracy of ultrasound for diagnosing malrotation with or without midgut volvulus. The study shows moderate certainty evidence that suggests excellent diagnostic accuracy for ultrasound detection of malrotation with summary sensitivity of 94% and summary specificity of 100%. There was no difference between the sensitivities of upper GI and ultrasound. However, there was a significantly higher specificity for ultrasound than upper GI. Radiation dose reduction during intra-arterial chemotherapy for retinoblastoma, a retrospective analysis of 96 consecutive pediatric interventions using 5 distinct protocols. This was a retrospective study from 2015 to 2020 based on 5 imaging protocol types, a combination of uniplanar versus multiplanar imaging and digital subtraction angiography versus a roadmap angiographic technique were used in the protocols. The authors showed that revisions to procedural imaging techniques can dramatically reduce radiation exposure during intra-arterial chemotherapy for retinoblastoma without adversely affecting technical success or safety.
Use of angioembolisation in pediatric polytrauma patients with blunt splenic injury. This was a retrospective study which looked at outcomes of angioembolisation after splenic trauma at pediatric and adult trauma centers. It showed that angioembolisation had lower rates of splenectomy without difference in mortality. However, pediatric patients at pediatric trauma centers were less likely to undergo intervention than at adult trauma centers.
Accuracy of CT for measuring femoral neck anteversion in children with developmental dislocation of the hip verified by using 3D printing technology. This was a retrospective single-center study that evaluated the accuracy of CT methods in measuring the femoral neck anteversion angle using 3D printing technology for verification. The 3D printing method confirmed that femoral neck anteversion angle measurements made on 3D CTs were more reliable and more accurate compared to measurements made on 2D CTs.
Pediatric discoid meniscus. Can magnetic resonance imaging features coupled with clinical symptoms predict the need for surgery? This was a retrospective study which assessed the ability of MR to help predict the need for surgery in patients with discoid meniscus. Overall, the best predictor for surgical treatment was mechanical symptoms such as pain or locking. However, some MR measurements can also help predict the need for surgery.
Prediction of high-grade hip joint effusion with simple radiographs in children, a comparative study with magnetic resonance imaging. This was a retrospective study from 2000 to 2017. It analyzed the predictive value of asymmetric joint space widening on radiographs for the presence of hip joint effusion in children with unilateral hip pain or limping. For children aged 6 years or older, asymmetric joint space widening on radiographs has high specificity for high-grade joint effusions, and that further evaluation with ultrasound or MRI would be warranted. A major limitation of the study is that low-grade effusions or bilateral joint effusions may be missed based on this predictive model.
Rate of resident recognition of non-accidental trauma. How well do residents perform? This was a proven simulation which assessed how well radiology residents could identify non-accidental trauma while on call. It showed that residents do well at identifying non-accidental trauma on skeletal surveys, but that they do not perform as well on routine studies not meant to assess for non-accidental trauma, such as routine chest radiographs. Asymptomatic macrocephaly, to scan or not to scan. This was a retrospective study over 10 years which showed that head ultrasound along with clinical follow-up are reliable for detection or exclusion of relevant pathology in pediatric patients that are asymptomatic with microcephaly. Association of clinical guidelines and decision support with CT use in pediatric mild traumatic brain injury. This was a cross-sectional study which showed that institutions with clinical guidelines and clinical decision support in place could reduce the rate of head CT use in traumatic brain injury.
Thank you so much for listening. For more details, please visit our blog where you can also find the links to the original publications. Feel free to share your thoughts and questions on the Pediatric Radiology Forum. See you next time.